Dr. Tess Mauricio, founder of M Beauty Clinic, and I'm so happy to welcome each and every one of you to our RHA virtual event. Please make sure to stay with us till the end of the event so that you can ask questions during our live Q&A. And also there will be live drawing for special raffle prizes, and you must be present to win. And there will be attendee-only specials that we will be letting you know throughout the event. So sit back, relax, enjoy our RHA virtual event. Here we go. RHA fillers are hyaluronic acid and the first and only FDA-approved hyaluronic acids designed specifically for dynamic wrinkles and folds. Now, what are dynamic wrinkles and folds? Where these are lines and wrinkles and folds that are created when we're moving. And the traditional fillers were not designed for that. And so the lines that you see when you're talking, you're smiling, you're animating, you're expressing, RHA are really designed for those lines. And so we're really excited at M Beauty Clinic to bring it on, because this will just add to our armamentarium of fillers to offer and to customize for you. As you know, here at M Beauty Clinic, we really are always looking for the cutting edge and most advanced technologies to really optimize our patients' treatments. We also are huge about customizing treatment plans for patients, and that goes with fillers. And so there are many patients that need different types of fillers depending on what they need. Some people need structural support and restoration. Some people need volumization all over. Some people need recreation of the jawline, the cheekbones, and some need filling of individual lines, and some even need individual filling for acne scars. And some need a combo of both, of all of them. And so what we love about RHA is that it gives us flexibility, and we're able to customize the treatments for the patient so we can get the very best results. I feel like anyone who needs a filler can be a good candidate for RHA. The patients that come to M Beauty Clinic want natural looking results, and that is what we stand for. That is what we believe in. Looking your best, but not looking like you've had work done. And RHA is really perfect for those who maybe are nervous that they may look different, that they may look unnatural with fillers. Those who've had fillers in the past and may want their fillers to last longer. Also, those who've had fillers in the past and maybe felt like it was too heavy, it didn't move, or it made them look unnatural. RHA will allow fillers to look very natural, and it is designed for dynamic wrinkles and folds, like around the nasolabial folds, your lips, your upper lip, your chin, the cheeks, where you really animate and move a lot. And so all I can say is that RHA is perfect if you want to have fillers done, but look absolutely natural. The beautiful thing about fillers is that it's instant gratification. So it really is like magic, and especially when done well and expertly done and artistically done. And we believe here at M Beauty Clinic, those are the kinds of results that we deliver for patients. And so when you come in and have your fillers done, immediately after the treatment, you will see improvement that hopefully you will look at the mirror and say, wow, and you'll love your results immediately. Obviously, there may be some swelling involved, and swelling may happen over the next few days. It's also normal to have a little bit of lumpiness just from the swelling and inflammation. In about 2 to 4 weeks, everything will settle, and that will be the results that you'll have for many, many months. After your fillers, we will apply vitamin K cream on your skin, and we will send you home with some. We also encourage you to ice the areas to minimize swelling and bruising. We use AccuVein technology, which is infrared technology, to identify veins under the skin to minimize the risk for bruising, and so that patients will have minimal downtime with this procedure. If you're having your lips done or areas around the mouth, those are areas that tend to bruise more, and so plan for at least about a week where you don't have any major celebrations, occasions, or events where you have to look perfect for. We use cannula technique to deliver fillers all over the cheeks, and with a single opening, we can revolumize and treat the entire cheeks and jawline and around the mouth, and so that technique also minimizes your risk for bruising and downtime. Also, remember that for 24 to 48 hours, you really want to minimize strenuous exercise because that will increase your bruising. And as well as you may want to skip alcohol during the 24-48 hours after your treatment to minimize bruising as well. And try to sleep on your back to decrease inflammation and swelling in the areas. RHA fillers typically last about 15 months. The studies show that The studies show that it can last longer than your typical hyaluronic acid fillers, which can only last 9 to 12 months. So that also makes it very attractive to our patients because not only are you getting natural looking results, it can last you longer. Now, some patients will metabolize the product faster. If you are losing weight, you also may see that the results may diminish faster, and so your results may be less than 15 months, but on average it can last you over a year and you can look natural the entire time. So we have our patient here. Her name is Crystal. She's gorgeous. But I'm going to have Crystal look in the mirror. And Crystal, tell me why you're here. What are we going to address today?
I have a little bit of scarring from some cystic acne on both of my cheeks, and I would just like to plump that up and make it look a little bit better.
Okay. And then, do any of the lines around the mouth bother you as well? Or?
Yeah, a little bit right here and here.
Okay, and then you're also very fit and very slim. And as we all age, volume of the face really goes down. And so that's kind of working against Crystal being healthy, slim, fit, because that volume actually contributes to plumping the acne scars. And you probably have noticed as you've gotten older that the scars have gotten worse. Is that true? Okay. So what we're going to use today are RHA 4 and RHA 2. And it's really nice because we can customize it for Crystal, because what I want to do for her is use RHA 4 more for structural support of kind of lifting and plumping the cheeks, provide a little bit, like you said, of volumetric improvement everywhere there, and that's kind of our goal today. And you can see that when that happens, that adds some structure and support to the scars, and the scars will improve. And then what I'm going to do is use RHA 2, which is a finer product, and this can be injected very superficially. And so I'm actually going to inject RHA 2 directly underneath the areas where she has scars, and then also do that directly underneath some of the very superficial fine lines around the mouth. Okay, so it'll be a layered approach, and that's what we do here at M Beauty Clinic. We really look at the patient, what the issues are, priorities, and then we can customize what types of fillers we can use, because each filler has its own characteristics and properties that we can use to really create amazing results for the patient. Okay, ready?
Yeah.
All right. So Crystal has already numbed, right? We put some topical numbing in here. At M Beauty, we really care that you are comfortable as a patient. So we have extremely strong numbing cream. And if you're really nervous, we also can have you use the nitrous gas or laughing gas anesthesia. And that will allow you to be a lot more relaxed. If you're nervous about the shots, injections, needles, all of that, we can make you comfortable. So here at M Beauty Clinic, we care about your comfort. We also care that we decrease your downtime, so we try to minimize bruising and also obviously make the procedure safe. So this is the AccuVein, and this is a tool that we use. This is infrared, and you can see these lines, dark lines here, are blood vessels. And we really want to avoid hitting the blood vessels, because when you do, the patient will have more bruising, and obviously also you can have major complications if the filler ends up being in these vessels, and it can create a lot of major problems, so we want to try to avoid it. I'm going to use a cannula, so what I'm going to identify here are the vessels. And then also look for a safe place where there are not a lot of vessels, and I'm going to mark it as X. And then that will be the area where I'm going to go in with the cannula. So what I like to use, some injectors will use a cannula, some injectors will use needles. So I use both combination. A cannula, will make a little tiny opening, and then this little tube here, the opening is all the way to the tip, but it allows me to enter through one area and then reach the entire cheek, essentially, from the sides to the mid-cheek to around the mouth with one opening. And then I'll save the needle if there are small little areas that I really want to perfect. But this allows me to do a global volumization without having to poke the patients many, many times. So here we go. Start, you'll feel a little poke here. Cannula's in, you can kind of see where the tip of the cannula is there. So at all times I know exactly where it is, and this is RHA 4. It's a beautiful product because it blends so well. And again, I'm using RHA 4 a bit deeper just to give a nice structural support to the areas that have lost volume over time. And again, because our patient is very fit and slim, has lost volume. And if you come close up now, you can see again that the acne scars already are looking better. They don't look as deep. And volumization is really important with scars, especially acne scars. So that looks better. And now I'm going to just go here, mid-cheek. She doesn't need a lot there, but again, just to balance everything. And this will also improve the lines around the mouth. And so this is RHA 4. And I'm going to show you, Crystal, we're not done yet. Just part 1. The mirror. Can we get the mirror, please? I'll erase this now.
Oh, yeah.
Right?
Yeah, it already looks better.
You see a difference? Mm-hmm. And smile. See?
Yeah.
And so I'll put the RHA 2 around here, and then more superficial there, okay? All right, and then we'll be finished. Okay. Easy? How was it?
Mm-hmm.
All right, good. So now I'm going to switch to the RHA 2. now I'm switching to RHA2. Again, this is intended for more superficial injections, more superficial treatments. And I'm gonna inject some using the same opening around the mouth and then a little bit here. And I'll probably use a needle to treat that there. So through the same opening, turn away from me a little bit, Crystal. So with fillers, the person's technique, your injector's technique, is like the most important factor in how everything ends up looking. The products now are all great. RHA really allowing us to have very natural results with dynamic movement too. So I'm going to try to inject some RHA2 more superficial here, right there where she has her deepest scars. You can see the tip of the cannula there. And just a little. And the beautiful thing about RHA2 is you can really blend it. So you don't have a lot of areas you can have lumpiness because it's such a fine product. You can really see how much better that looks already if you go close up. See how superficial we are there, but you're able to do that with RHA2. So RHA2 is really beautiful for superficial lines around the mouth. You can see we're finished here, and I'm just massaging so everything blends in, and with just that one opening, we're really able to correct a big area of the cheek there. All right, take a look, Crystal.
Oh, so much better.
Right? It's a little red just because I've been rubbing it, but even this area.
So much better.
And smile. There you go. And now that cheek's elevated. You have some natural volume, and if you even close up, if you go close up, you really don't see the scars as well. Now I'm just gonna go with a needle and just add a tiny bit more RHA2 just to blend it in. And of course, there are a lot of different treatments that we can do for acne scars besides fillers, but volume plays a big role with scars because the plumper the skin, the less noticeable the scars. Okay, take a look.
Oh, it looks so much better. Yay!
Right?
Yeah. Yeah. Yeah.
There you go.
I didn't even feel that.
You didn't feel it. Yeah, that's even the best.
Thank you everyone for joining us on our RHA virtual event. I hope that you found it entertaining and educational, and that maybe it inspires you to try fillers and RHA filler in particular. We'll ensure that here at M Beauty Clinic that you will be comfortable through the procedure. You will get natural looking results that you will love. And so I also want to encourage you to stay with me for another 15 minutes for a live Q&A. You can put your questions in the question box and I'll be more than happy to answer them. And also, I want you to stay till the end because we will be doing some live raffles and you could be the winner, but you must be present to win. Also, make sure to check your email because we will be emailing you all of the attendee-only specials. And there is a deadline to act upon all these incredible specials. So make sure that you take advantage of these incredible offers that's only happening for attendees of this RHA virtual event. Thanks so much, and we hope to see you all soon here at M Beauty Clinic. Hi everyone. I hope you all had great time watching. I know that was short. It's probably for those of you who've had participated in our other webinars in the past. This is probably the shortest one. Thank you for all the thumbs up. But I really want to encourage all of you, if you have any questions at all, this is your chance. Think of this as sort of like your virtual consultation with me. I know I'm not seeing you, but I'm sure that you all have similar questions. I know that I answered some of the most basic questions about fillers, RHA, the prep, the post care, but I definitely want you to feel comfortable to put in and type your questions, and I will be answering them right now. First, I just want to say, thank you a big thank you, because obviously a production like this really requires an entire team. And here at M Beauty, as you know, if you are one of our patients, we really have an incredible team. That we care about each and every one of you, and we all work together for a single goal of your happiness and you being exceptionally pleased and, just exceeding your expectations for treatments. All right, so I also want to make a special shout out to Lisa. Lisa is in the other computer, and a lot of the things that we do here at M Beauty, especially when we're doing these types of events, Lisa helps me out a lot. And I know those of you who are patients now, reach out as well to Val. Most of our staff have had fillers and they've had this experience. Many of them have tried RHA and the other fillers that we offer. All of the fillers that we offer at M Beauty Clinic are what you call hyaluronic acid fillers. And these fillers, hyaluronic acid is already in our skin naturally. So it naturally exists in our skin. And I only choose hyaluronic acid fillers because my goal in everything that we do here at M Beauty Clinic and what I stand for is natural looking results. And so RHA is resilient hyaluronic acid. That's what RHA stands for. It is dynamic, it's flexible, it goes and moves, and you really cannot tell where it's placed if it's done properly. Because, of course, with any filler work, the product is one thing, and we are so lucky now that we do have access to many different products with different characteristics so that we can customize your treatment, what we're trying to achieve. But the end result is really about expertise and artistry. And I hope you appreciated the patient that I just treated. She's really an excellent demo patient because one, obviously she's worried about aging. She's very thin, so she has volume loss. And we all lose volume as we age. And she also has fine wrinkles around the mouth, and she has acne scars. And so how do we address all of those? Well, we now can combine and use different types of products to really achieve results. And hopefully you guys really appreciated that after I treated that right side of her face, we achieved a lot of things. We were able to lift, we were able to improve the jowling, we were able to elevate the cheek, we were able to decrease the nasolabial fold or the laugh line. We were able to smooth the deep acne scars and improve even the quality and texture of the skin just by plumping with fillers. And of course, here at M Beauty Clinic, we don't just stop at fillers. You have access to all of the incredible high-tech, cutting-edge regenerative aesthetic treatment, laser, radio frequency treatments, and we'll combine that. And so for those of you who are not yet M Beauty Clinic patients, I do encourage that you call, email us, and get your free cosmetic consultations with one of my consultants, and we will go over all of your concerns and educate you. We are big about education. Educate you on all of your options and then give you quotes, and then you can prioritize. Okay? So, well,
I have a twin, and all these avoided fillers procedures for fear we won't look the same. Would you be able to perform similar service for both of us so we can continue to look like twins?
well, my goal is, yeah. So the question is, someone has a twin, and they don't want to do fillers. They're concerned about doing fillers because they always want to look the same. So they're asking me, can I perform this procedure and keep them looking the same, but probably just look fresher? And I promise you that my goal for any of my filler patients is that we maintain your authentic beauty. We are not about changing people's looks. We're not about alteration. It's about optimizing your natural beauty. And so when I come and see you, or when Angela, who's my sister, who's also an excellent practitioner when it comes to fillers, we really assess you. We do not do kind of cookie cutter type of filler work here at M Beauty Clinic. You can appreciate that when I treated that patient, I really was assessing everything. So not everybody going to get filler in the mid cheek if they don't need it. Not everyone's going to get it in their nasolabial fold if they don't need it. You really have to evaluate the patient as an individual, and it has to be customized. And unfortunately, in this field, there are a lot of people who do this, and they're injectors, but they're not artists. And so that's really the difference. And so I can honestly say that, with the type of work that we do, a lot of it boils down to evaluating, really communicating with the patient. I truly appreciate your question, because that is a concern, and that is what we will try to do. And that is what I believe in, and my philosophy about anti-aging altogether is just really maintaining your authentic beauty. We want to be authentic. Okay. All right. So questions. Can you use this on the chin and jawline? Absolutely. So, rejuvenating and actually facial sculpting with fillers is really getting to be very, very popular. So obviously you can augment and change the chin with surgery. You can get a chin implant, you can get a jaw implant, but using these fillers actually is one of the quickest, easiest, and like magical, almost like magic, right? And you can balance out, and you can create better proportion. You can create beauty. You can improve asymmetry that you're born with. And that results in a more confident person. And that is why I love what I do. And so absolutely, hyaluronic acid fillers that we use can be used for facial sculpting. We have a lot of patients who come in, and all their lives they've felt really, down and self-conscious about their chin, about their jawline. Also, as we all age, we lose volume in the jawline, and that contributes to the jowling that happens. So if you're looking at yourself right now, and you're like, oh, I have jowling here, what can I do? Do I need a major facelift? Many times, just adding the right amount and knowing where to apply these fillers can really create improvement and lifting of the jawline, improvement of the jowls, improvement of the marionette lines and the nasolabial fold. And the chin also loses a lot of volume as we age. And so you almost feel like, that nice heart shape, a face shape that you may have had when you were younger is gone, and you're starting to have all these textural kind of irregularities on the chin. A little bit of filler can help with that. Also, we are also experts here in neuromodulators. Botox and Jeuveau can really do a lot to create amazing facial shaping of the jawline if you want to slim the face. To project the chin, we have a very special way that is kind of like a very high level way to use Botox and Jeuveau. And I've taught this to a lot of doctors. Recently, I just did an anatomy course using toxins. And I taught a lot about how we can make the chin look a lot more attractive, how we can project the chin using these neuromodulators, neurotoxins, combine it with fillers, and it's amazing. All right. What's the chance of RHA filler traveling to our eyes and can affect our vision later? Okay, this is a very, very important question. Thank you for asking this, because here at M Beauty, safety is our number one priority. That is why, if you watched the video of me treating the patient, we really try our best to not get the hyaluronic acid filler in a blood vessel. When that happens, one, you can block the blood flow, and you can basically have necrosis. Part of the skin can die if you don't act and reverse that right away. And with hyaluronic acid fillers, fortunately, there is a way, there is an enzyme that can be injected that can dissolve the hyaluronic acid. But of course, we'd rather not get there. Knock on wood, we've never had to inject hyaluronidase, that enzyme, on any of our patients. But you saw that green light that I used before I even made any kind of injection. That is the AccuVein infrared vein finder. So what that does is it can detect some of the more superficial blood vessels that are in the areas where we're going to inject. So absolutely, that not only decreases the risk for a bruise, because if we do hit a blood vessel, the patients will bruise, and then they'll have more downtime. And we want to make this as easy and no downtime for any patient. But more importantly, which is the point that question was, is we don't want the filler in the vein, because there are certain blood vessels, particularly around the glabella. This part here is called the glabella, around the nose and around the eyes, that actually these blood vessels connect to the blood vessel that feeds your eyes. And if there is filler that goes in the blood vessel and travels, it can cause blindness. And most of the time, I'd say almost 100% of the time, it's not issue with your vision, it's instant blindness that is irreversible. This is one of the big reasons why here at M Beauty, I no longer inject fillers in the nose, the glabella, or the tear trough area. Okay, so I try to avoid those danger zones that, not only you're not worried about the skin maybe dying because there's no blood flow, but blindness that's irreversible. I don't want to even go there. I don't even want to risk it. Okay, so one is the AccuVein. Number two, if you notice, every time I go in, I withdraw, I aspirate. And every time I go in with a needle or a cannula, I'm pulling back. And if you've had your blood drawn for any reason, you probably have seen this where, the technician will go in and then they pull back in the syringe, and you'll see a flash of blood. That tells them that, yes, they are in a blood vessel. And if they're going to give you medication or if they're going to draw blood, they know they're in the right place. With us, we don't want to be in a blood vessel. So every time I inject, and the same with Angela, we withdraw, we aspirate, so that we can try again another level of safety for you guys. It takes more time. A lot of doctors and a lot of injectors do not take the time to do that. When I watch them on social media, it makes me so nervous, because I've had sometimes where I've aspirated and there was a flash of blood. And I pray and I thank God that I did that, took that extra time to aspirate, and I didn't just inject. So that's another level of safety. So hopefully that helps. And there is a lot to think about. Sometimes when I teach these courses, when I teach toxins, when I teach fillers, and people watch it, they think it's so simple that they can just take a weekend course and boom, just do it. There's a lot that should be going in the minds, considerations, safety, the aesthetics, the end result, planning with how many syringes you have. There's a lot of things to think about that really should be going through the mind of whoever is injecting you. So it's not as simple as you think. And this is why, there are results that are excellent, and then there are results that are not so good. Okay. How long have you been using this product on patients? So RHA we've had for almost a year, and I really, really have loved it. I'm so picky what products we introduce at M Beauty Clinic. We also still use Voluma. We also still use Juvederm, Reviness. These are excellent products, but RHA obviously is the newest one. It is the newest in the field, and we love it. I really love it, especially for patients who are thinner, like the demo patient, because it really blends well. You don't see it. It doesn't get lumpy. And then also for older patients where the skin is thinner. And then, of course, like I said, super fine lines. Actually, yesterday I just treated a patient. She had a lot of lines around her mouth. And so what I did for her is I did a combination where I did Voluma for the deep structural support, for the jawline, for the cheeks, and then I did RHA4 for more the mid cheek area, because that blends in and it's not going to show because she had a lot of sun damage and her skin's thinner. And then I use RHA2 for all of the superficial lines in her chin around the mouth. She loved it. She loved it. She's happy. And she looked 100% natural. You would not be able to tell that she's had fillers done. And so that is my promise. Do you recommend arnica or ibuprofen to reduce inflammation? So as you saw in the demo, I'm able to really create an overall rejuvenation, revolumization using just one hole, that cannula opening. Cannulas are essentially, sometimes if you're not in the medical field, it looks freaky because it's going under your skin, right? It's going under your skin. I'm tunneling it. But why do I use a cannula? One, it's safer because it's a blunt tip, so it's less likely to puncture a blood vessel. And I already told you why we wouldn't want that. Number two, because when we lose volume as we age, you don't just lose volume in one area. This is why I really feel if an injector is not an expert, they just put it all here and then the patients look weird. You don't just lose volume in your mid cheek. The volume loss in the mid cheek comes from many different areas. That jowling comes from volume loss that's global. And so when I just make a little opening, there's actually very little downtime. There's a lot less risk for bruising. So yes, we tell patients, don't take, ibuprofen, get off your vitamins, multivitamins for about a week, because that can increase your risk for bruising. We do apply arnica, vitamin K gel after. We do encourage patients to do that. You definitely can ice after, but usually patients are fine. Around the mouth though, and then when we're using a needle, and sometimes you saw towards the end when I'm really just finessing, I will use a needle. And with super, super fine lines, when I'm going very, very superficial and I can't reach it with a cannula, and I don't feel like I can really, do the best job with a cannula, I will still switch to a needle. And then around the mouth, there's a lot of little blood vessels there. Your risk for bruising is higher. And obviously the lips, a lot of blood vessels there, you can be more bruised. So you just have to prepare. You don't want to get fillers, when you have to look perfect within a day or two. You really want to give yourself about a week. Now, if you have a big event coming up and you have a week, oh my gosh, you need to consider a filler, because as you saw, it's like magic. It's instant gratification. It's really like, I love doing fillers because I feel like I'm a magician and the patients are instantly happy. And I love to show them that half face, with the mirror, because they can really appreciate what we've done and they can appreciate the artistry and the expertise that goes into creating amazing natural results. How long would that last with the gel? So like I mentioned, RHA can last up to, 16 months. It really depends on the patient. Your metabolism really depends on the patient. If you work out a lot, You can increase the metabolism so your fillers can go faster. If you're naturally slim and you're naturally, fit, then you may find that your filler effect is not lasting as long as someone who already has natural volume in their skin. Also, if you're planning on losing weight, and everybody now post COVID is trying to lose weight, so volume fat is obviously a volumizer, right? And so the cool thing about having that extra weight is that our face, is definitely plumper. And but when we lose weight, we will lose some of that volume and structural support. And it's not that your filler has gone away, it's just that when you lose weight, some of the fat volume has gone away, and so you may need to augment your fillers, come on in, and then we can, give you a little touch up to get you back to full correction. I admire your steady hands. Expertise. Thank you. Thank you. Like I said, when you're watching, it looks a lot easier, but I do take my time. M Beauty Clinic, we are not a toxin and filler factory. Okay, what we're not. I know that there's a lot of like maybe Groupons and things like that out there. When you come see us, and if you've already experienced being an M Beauty patient, you know that we take our time. I mean, if I'm doing a filler, you saw how long that took, and that was edited, and that was only half face. So something like that can take me about 30 minutes, 20 to 30 minutes. And so I can't really run through so many patients because, like I said, there's a lot of decision making. I'm also having the patients move as I'm injecting. This is another mistake that a lot of practitioners make, is that they only inject when patients are not moving. Do I look different like this versus like this, right? There's a change that happens. And so you have to evaluate, because most of the times patients are moving. The no smiling, look straight ahead are really only for photos. It's not for real life. And so as I'm adding the volume, as I'm augmenting, I am seeing how this affects all the other areas. I'm seeing how this affects the jawline, the nasolabial fold, the acne scars, how the cheeks elevate when they're smiling, how the chin projects when they're moving, they're talking. So it takes time to do that right. Can you do the Botox and Jeuveau? Absolutely, on the same visit as your fillers. Yes, and it's routinely done in our clinic. We respect the fact that most of our patients are very, very busy. So we try to do as much as possible while you're here with us. So what can you do when you have your fillers done? You can have your CO2 lift mask. Those of you who haven't tried that, carboxy therapy, it's awesome. It's awesome to do that. It decreases inflammation, it decreases bruising, and it automatically hydrates and oxygenates the skin. The other thing is obviously your Botox, your Jeuveau. I'm just going to put a plug in for Jeuveau because we are going to have the Java and Jeuveau days. We're posting it on social media. Please take advantage of it. If you've ever thought about Botox, you've never had it done. Okay, so Jeuveau is now our favorite toxin. We've been using it now in our clinic for almost 2 years. I've had basically for the last 2 years, I've only had Jeuveau done. And you can see, I'm going to be 50 November 13, guys. I will be 50 years old. And I'm telling you, I am so passionate about what I do. I'm so lucky to live in a time where we have all these incredible technologies to really allow us to look and feel our very best at any age. And you don't have to go overboard. You don't have to go through surgery. You don't have to look unnatural. You can keep your authentic beauty, but feel your best. And so, what was I talking about? Yes, Jeuveau. So we're going to have Java and Jeuveau days. We also have $40 off. Anytime you come in for Jeuveau, especially if you're a first-time user of Jeuveau, I would say if you've done Botox, you must try Jeuveau. Try it once. Over 90% of our Botox patients now use Jeuveau. They love it, especially for forehead lines that are like if you have like a lot of lines in your forehead and you don't want your brows to drop, or if you've had an experience with Botox where your eyelids dropped and droop because of Botox, that's Jeuveau is a lot more precise. And so you're less likely to get that. And that's why I like to, because I like my brows slightly elevated. I don't like it flat because, with Asian eyes, we naturally already have heavy eyelids. And as we age, we also get naturally heavy eyelids. And so, what our goal is when we do Jeuveau, and again, there's so much complexities to doing Botox or Jeuveau right. That's why there's bad work that's being done there. It's not as simple as just like injecting. There's a lot of planning. There's a lot of educating patients as well. And so we can raise my brows, but not have any lines on my forehead with Jeuveau. So that's cool. Can you do this in combination with the time machine procedure? Yes, time machine procedure. We love it. Guys, I told you I'm going to be 50 November 13. And I just had my time machine procedure 2 weeks ago. And yes, time machine procedure is our number one all natural, complete anti-aging procedure that addresses everything they think about when you're thinking about aging. And that is your wrinkles, your sagging, your saggy eyelids, dark circles, hollow folds, acne scars, pigmentation, even the neck. Okay, you guys have to take a look at my neck because for almost 50. So I also treated my neck, and we now have this incredible new skin tightening treatment that can be combined with our fillers and can be combined with Jeuveau or Botox. It's called Pixelate. It's RF microneedling, and I used it for my time machine procedure along with, platelet-rich plasma, microneedling, Skinfinity, plasma. I mean, all of the things that we have here. Combination of that's what we call our time machine procedure. But you don't have to know like exactly what we're using, why we were using it. Just trust. Dr. Tess has picked the best technology already, and it's going to be customized for you. How soon can I use microneedling? You can do it on the same day. So we have a lot of patients that travel to San Diego, to Beverly Hills from all over the world, and they need to do as much as possible in a single visit. And so it's very routine for us to do the fillers and then do the time machine, which includes microneedling. That's just a small part of the time machine procedure. The vampire facelift is just a small part of the time machine procedure. You get so much more bang for your buck when you do the time machine procedure. So you can do it the same day. Kimberly, you're beautiful on the inside and out, Dr. Tess. Thank you for everything you do. Thank you. And Kim has been my patient for many, many years. We I think over 10 years, and she's looked amazing. And so, we both know that these things work. And Angela, just saying that I'm super lucky to have such an awesome trainer and sister, Dr. Tess. Angela is excellent. I cannot inject myself. So people ask me all the time, okay, Dr. Tess, do you do your own treatments? You look awesome. I do not. I cannot. I am a big baby when it comes to pain, which is one of the reasons why at M Beauty Clinic, we really make sure you are going to be as comfortable as humanly possible. So not only do we give you the strongest, most effective topical numbing cream, but we also give you the option if you're having fillers done, if you're nervous or you don't like shots, you're worried about it, to use nitrous gas or laughing gas anesthesia. And I'm just going to be honest, whenever I get fillers or your time machine procedure, microneedling, anything that requires shots, I use the nitrous gas. So you have that available. This is an incredible technology. Nitrous gas, it's 50% nitrous oxide and oxygen. You administer it to yourself. You can get deep in anesthesia where you don't care. You're happy, you're relaxed, and you can have all the things you want done. And then when you're finished, you stop inhaling and you go back to get, to normal, and you can still drive home. And this is not available in many offices, but we decided to invest in this because we want your experience at M Beauty to be really pleasant, be really nurturing, and that goes from your practitioner, whether it's me, Angela, Rick, to our estheticians, and to all of the staff. Really, we're so lucky because we do have people who truly care. And I get people say this all the time. Even my friends and patients who are doctors who run their own clinics. They're like, Doctor, Tess, you have amazing, loving, caring staff. And so I hope those of you who are not yet M Beauty Clinic patients to try and see and experience for yourself. Okay, I hear a lot about being overfilled with fillers. How do you avoid overfilling? Okay, so we're talking about the advantages of hyaluronic acid fillers, because hyaluronic acid is already part of our skin. But the truth is, guys and ladies, is that it's all about the expertise and the artistry of who is doing the filling. It's sort of like your hairstylist, right? They can all have the same tools, the same scissors, but you have artists where you go in, you're like, oh my God, this is incredible. And then someone can just chop your hair and make you look horrible. So unfortunately, I would say it's luck, because if you end up with someone really good, it can be amazing, and you can be walking with confidence, and people will, you walk in a room and they'll just be like, gosh, you look amazing. Have you been on a vacation? You look rested. They won't believe your age, but they're not going to know you had fillers. And that's our goal here at M Beauty Clinic. Always, always. Can we exercise after RHA treatment? So I still tell patients you can exercise, but you don't want to really raise your blood pressure the first 24 hours, because that can increase your risk for bruising, especially if you've had fillers like in your lips or areas where you can bruise a lot. Okay, all right. Any other question? Time machine. I just want to make sure. I can talk about this forever, as you guys know, but I encourage you guys to just come to the clinic. Okay, they want me to read about our attendee only specials. So there's so many of you. I just want to just say I am so touched. I'm so feeling the love, because we like to do these events, and there's a lot of production and effort that goes into creating quality content that you will find meaningful. I always respect your time. And so thank you. And I hope that you found that this has really been helpful. But attendee only specials. So if you're watching right now, you can get either $100 off any syringe, okay, the filler, or you can buy 3 and get 1 free. So if you're like, well, I think I'm just going to try 1, we'll give you $100 off. But if you're like, I really want to get an incredible deal, you can buy 3 and we'll give you the 4th free. And we'll let you, sometimes you don't need all 4 all in one shot. And, we will be very flexible. You can bank 1 for later. But really, ideally, if you prepay for the treatment, we want your treatment to be complete by November 30, because this is kind of what we've worked out with the company. And so, but buy 3, get 1. That's a huge, huge deal. Or if you're watching this, we know you're interested in a filler. We know you want to try it. And so you get $100 off any of the fillers, any syringe. Okay. And then cannot be combined, it says, with any other offers or specials. You must, okay, this is the caveat. Of course, we want you to get a good deal. Thank you so much for joining, but you must book or prepay by this Friday. So today's Wednesday. So call tomorrow, call on Friday, prepay, book your treatment, lock in your special pricing by the end of the day on Friday. And you can, and then end of the day on Friday, you can put in a $50 deposit to hold your appointment, and you'll be able to take advantage of all of those specials. Okay, so let me see. You're amazing and brilliant in your artistry and expertise. You are the answer to my prayers. Oh, thank you, Chriselle. I'm grateful to have found you and all your awesome staff. Thank you for helping me maintain, freshen, and improve. Happy early birthday. Hoping to visit you before both of our big birthdays. Yay! Thank you so much, Chriselle. You know, I've been in practice now since 2004, and building these relationships with patients and knowing that I'm able to help my patients really live their best lives with all of these incredible technologies and incredible products that are now available to us, it really has made my life meaningful and worthwhile. And so those of you who know me know I work very hard, and those my staff know that I work very hard, but it's really truly worth it. Thank you so much, Michelle, and thank you so much, Chriselle. And now raffles. I promise there's going to be raffles. There are 3 raffle items, and we will announce the winner tomorrow on, what's that?
Social media.
On social media. Can't understand Lisa's writing. So we'll announce the winner on social media. So
And
please
call you.
make sure you check the social media, and you will get a call because we know your information because you registered for the event. So the raffles, the items, OCMD, serum and cream. So OCM, let me just say OCMD serum and cream. If you haven't tried it, this is an amazing, affordable way to really get your hands on some luxury ingredients. And so if you haven't tried it and you're worried about spending a lot of money on some of the other products that we offer, try OCMD. I'm a big believer. I use the serum and moisturizer twice a day, and I combine it with all of the other incredible products that we offer, like Illumier, like Tensage, like Jan Marini. It really depends on what I'm trying to achieve. It depends on the day. It depends on how my skin is doing that day. And, you know, multitasking products, but OCMD, serum and cream, one of you will be the winner of this $150 value. Jeuveau, I talked a lot about Jeuveau. So if you have lines around your forehead, around the eyes, 20 units of Jeuveau treatment with either Rick or Angela. That's a $200 value. So someone will be more wrinkle free going into the holidays, and we'll announce that tomorrow. And of course, this is an RHA event. Someone will be a lucky winner of one of the RHA syringes, either an RHA 2 or a 4. And when you come in, we'll determine based on what you want treated, which one is best for you. Because like I said, we customize our filler plans here, okay? And that is up to $1,100 in values. That's like our grand prize. And so hopefully one of you guys will be walking around feeling so confident with the RHA. Wrap it up. Okay, that's what they're saying. Wrap it up. Okay, so let me remind you guys again our specials, because you must take advantage of it. The holidays are coming. If you get this done now before November 30 or October, like I said, the results are instant. So for the entire holiday season, even all the way up to New Year, you are already going to look amazing for all your pictures, for your events, especially now that there's so many events. Actually, I attended like 3 or 4 events this weekend, and people actually haven't seen me, and my patients haven't really seen me in the clinic, how I look, because I'm always wearing my mask and my shield. So I love these events because you guys get to see me and you get to kind of inspect my skin very close, and you know that the treatments work. So the specials, $100 off per syringe. If you're just going to get one syringe, we will give you $100 off. But the big bang for your buck deal is if you buy 3, you will get 1 syringe free. And like we've already mentioned, that could be up to a savings of $1,100. So, if most people, unless you're super young. So, for example, the demo patient that you saw, she's really young, but she just was thin and had acne scars, already needed 2 syringes. And she probably can use a third to really fill in the acne scars. So most of you, if you're already looking at yourself and you have some jowling, if you have like real lines here around the mouth, you probably can use 3 easy and probably 4 for full correction. So anyways, those are the specials. And remember, you must book prepay by Friday, October 22nd, this Friday, by end of day, with a $50 deposit to hold your appointment. And if it's prepaid, your treatment must be completed by November 30. So that's already after Thanksgiving, but you want to do this before Thanksgiving. And it cannot be combined with any other offers or specials. All right? All right. So thank you all. I love you all, and we hope to see you here at M Beauty Clinic. And please, if you're new to us, call and schedule for your free consultation, and we will love to help you with everything. We do everything from head to toes, even body shaping, lipo, hair restoration, women's intimate health, everything that's probably worrying you when it comes to your skin and your body. We probably have a solution for you. So thank you all. Till next time, have an amazing evening. Bye.